Hi, my name is Joe Carreel from Eat, Play, Thrive, chiropractor and movement coach. Today I'm going to speak to you about movement and how you can move effectively and efficiently with less pain and less potential for injuries just by addressing three key criteria. Those being your posture, your muscle health and your stability. So let's start off with posture. Static posture is obviously going to be very different to once you start moving, but you've got to have a base where you're starting with static posture first, and then that can translate into your movement postures. So using a wall as your guide, you can stand with your feet just a little bit in front of the wall, so you're leaning slightly back into it. You're using the wall as a prop to hold your posture up. Putting or sinking pressure into your heels to start off with. Your feet are your foundation to your posture, so what happens at the bottom is greatly going to influence what happens higher up, so always consider the ground first. Have just a little bend in your knees, make sure your feet are hip width apart, and standing with your back against the wall, you want to feel 4 spots against the wall. So that's your bum, your shoulder blades, back of your head, and the back of your arms. Once you've got those 4 spots against the wall, next thing what you want to do is lengthen through your torso. So you almost want to take the bottom of your rib cage and lift it up away from your hips. So you're elongating that area where all your abdominal organs are. So you're giving that area essentially more room to breathe. Then from there, moving up to the rib cage itself, you want to expand through your rib cage. And remember that your rib cage covers the front, the sides and the back. So you think of pushing your rib cage forwards into your chest, out into your armpits and back into the wall. Then from there, pushing the back of your head up against the wall. So you're almost giving yourself a little bit of a chin tuck as you do that. Make sure you can feel the back of your arms against the wall. So as you can see, my palms are facing either in or forwards, but they're definitely not facing back. Then lastly, you probably feel that there's a fair gap where your lower back is in the wall. What you want to do is you want to decrease that gap. So sucking my belly in towards my spine and then pushing my spine back in towards the wall without losing tension on all those spots that we spoke about. Heels, you want to feel your bum against the wall, shoulder blades, back of arms, back of head, lifting your rib cage up away from your hips, expanding through that entire rib cage, pulling your belly to your spine, spine to the wall. So once you've got that posture covered, then what you can do is step away from the wall and replicate that. And it's always more revealing to show posture side on. So I know my posture still needs quite a little bit of work, but just work through all these posture cues with me and we can fix each other's posture as we go. So you're putting more pressure in your heels, you're almost sinking into your heels, feet hip width apart, little bend in your knees. Remember to lift your rib cage up away from your hips, expanding through the rib cage itself, so pushing into the front of your chest, into your shoulder blades and into your armpits. Little bit of a chin tuck, pull your belly into your spine, and you're almost trying to flatten that spine out by what's called a posterior pelvic tilt. Imagine you had a tail and you were tucking your tail between your legs without squeezing those glute muscles. So you want to try and keep those muscles fairly relaxed in that position. So that's going to get you into a good static posture. Obviously from here it's going to feel a little bit awkward to try and move, but the whole idea is to engage those muscles that support your posture so that when you start moving, those muscles are turned on or switched on or activated to ensure that you've got good stability once you actually start moving. So that's looking at your posture. The next thing on our checklist is muscle health. And the way we can address that is simply with a foam roller and a tennis ball, or if you need something a little bit harder or denser than a tennis ball, a lacrosse ball works quite well, or maybe a cricket ball. But tennis ball for me is actually enough. The foam roller is just a gentle once over, so it basically just gives your muscles almost a good sweep to get them warmed up and ready for something a little bit more intensive or aggressive like a tennis ball or lacrosse ball. I always like to start from the ground and work, or the bottom and work up. So starting off the calves, and you can section off your body into your lower limb, leg, thigh, then your midsection, your back, shoulders, arms, etc. You can either do both legs at the same time, or you can get into one leg individually. So going through the calves, and I'll just quickly run through this, onto the hamstrings, working from the back of your knee all the way up to your sitting bone, flipping over and going onto your shins, so from your knee down towards your foot. What you'll feel as you're going through these movements is that it'll feel like you're getting a little bit of a core workout at the same time, which is absolutely fine, it's a bonus. Moving from your knees up towards your hips, again you can do one leg at a time, just to get a little bit deeper into those muscles, putting a little bit more weight through the movement. Then your glutes, your sitting bones, going from your sitting bone up towards the back of your hip, and we're moving up towards the lower back, and manipulating the body around the foam roller for this one, from lower back up to mid back. I'm just running through this really quickly, but what I'd recommend is around 10 strokes or 10 movements up and down in each area. Into the neck from here, a little bit of a chin tuck as you turn your head from side to side, and just be careful not to put too much downward pressure on the roller for this one, because you do have some sensitive nerves and blood vessels in the back of your head and neck. Moving on to the forearms and the arms themselves. And there you have it, just a quick sweep from head to toe. Once you've gone through that, what you probably notice is that there will be some tight spots or some areas that feel a little bit icky and sticky compared to others. So the tennis ball is there to get into those real tight bits. Again, you're working from the ground up. You might have a little bit of tension through the intrinsic muscles of the feet or even the plantar fascia itself. The way to do that is to stand up and roll the ball along the length of your foot from the ball of your big toe down towards your heel, putting downward pressure into it. Calves is a very common point, often getting tension through that muscular-tendinous junction between the Achilles tendon and the meat of the muscle there. So you might find a spot there, often higher up towards the lateral or medial sides of the muscle. So just depending on where you feel the most tender spot or tight spot, place the ball in that area. Once you feel that tenderness or painful area, just doing small movements up and down until you feel a little bit of a release, until you feel a little bit of give or decrease in pain in that spot, and then you move on to the next one. So you commonly find those tender spots pretty much wherever you have muscles throughout your body. But if we just go through the main ones in the bigger muscle groups, I went through the calves. You often have one in the shin, either higher up or lower down. Normally the mid muscle belly is okay unless you have a specific injuries there. In the quads, you normally find right in the center of the quad there'll be a spot there. Then to the lateral side of the thigh, so just on the outside there, you'll often find. You might even find along the adductor muscles on the inside of the thigh, and then there's almost always a spot just between the bottom part of the iliotibial band and the hamstring muscle, so just in that posterolateral aspect there. A good area that a lot of people forget about is the crease of the knee. The method I use for this is to jam the ball into the crease of the knee there, grab the shin and just pulling heel to bum till you feel a little bit of tension, and do it almost as a pumping action in and out. Okay, glutes is a common area. You know, it might be the glute max, glute med, glute minimus, even into the TFL, which is really common tight spot, and then moving up to QL muscles in the lower back, up to the rhomboid muscles between the shoulder blades, to some of those rotator cuff muscles, the posterior shoulder there, so muscles that cross the gap between the shoulder blade and the arm, just above the crease of the axilla or armpit. The front of the chest, very common. Biceps is another big one. And then your common tendon spots or tendon insertion or origin spots for your wrist extensors and your wrist flexors. So you want to work through all those areas, making sure that you cover the most tender spots that you can find. Once you've addressed those, then move on to the next one. Okay, so once you've addressed your posture, you've addressed your muscle health, next thing to look at is your stability. The good way to explain stability is for every movement that you take, there's going to be a group of muscles that are involved with actually propelling that movement or causing movement, and then there's going to be a group of muscles that basically prevent you from falling or help to stabilize your body so that you can move effectively. So something simple like a bicep curl, my bicep muscles are involved in levering my forearm up towards my arm, but at the same time there's a whole group of other muscles working, and fascia, connective tissue, that's ensuring that I can do this movement without my arm flailing. And so for every one movement that you make, there might be 100 other things going on with your connective tissue and other supportive muscles to ensure that you can actually move effectively. A good way to demonstrate this when you're actually feeling it is getting on all fours, and you're pulling your wrists, or your line of drive is pulling your wrists back to your knees. So from here, pulling as hard as you can without actually sweeping your hands along the ground. So there's a little bit of downward pressure at the same time pulling the wrists back to the knees, and by doing that you should feel like the lat muscles, the muscles just under the armpits, and the deep abdominal muscles are having to engage or switch on or activate in that what's called isometric contraction. Then from here you can engage in a little bit of movement, just rocking your shoulders back and forth over your fingertips and behind your wrists, and all the time keeping that pull of your wrists towards your knees. So by doing that, there's going to be a group of muscles that's involved in stability, and then there's a group of muscles that's involved in the movement. Same thing you can work from the lower half, so instead of pulling wrists to knees, now reverse it, do knees to wrists. And you might feel that you've now got more recruitment of the anterior thigh muscles and the lower abdominal muscles to stabilize, going through the exact same movement, rocking back and forth, and as you do that you keep on pulling your knees to your wrists, just to identify or separate the movement from the stability. In your standing posture, especially in what's called a unilateral stance, so with 1 foot forwards and 1 foot back, which is essentially what you're going to be doing when you're walking or running for that matter, you can replicate this as well. So pulling my lead heel towards my toes and push towards my back toes, and pushing my back toes towards my lead heel without actually sweeping my heel back or pushing my toes forwards. So I've got that, again, that isometric squeeze or that constant contraction of pulling my left heel back and my right toes forwards. And by doing that, you should feel all the muscles around your thighs, front of thighs, back of thighs, up around your hips, even the core muscles engage to hold that squeeze. And once I start moving from here, it's a more purposeful movement with greater stability, which means that there's less chance for things to go wrong, less potential for injuries, niggles, aches and pains. So what we've addressed now, just to recap, is regressing from movement. You want to look at your posture, you want to look at your muscle health, and you want to look at your stability. It's not to say that you can't move without these things or without addressing these things first, but what you want to do is you definitely want to regress before you progress. So if running's causing you pain, if you're getting recurrent niggles and injuries, you've got soft tissue meltdown, your posture tends to get really sloppy towards the end of a run, then go back and address these basic elements. your posture, your muscle health, and your stability. By all means, keep on running, but run pain-free. So you might need to decrease the amount of running you do, you might need to alter the terrain you're running on, you might need to alter the intensity you're running as well, and of course alter the duration. So stick with these key points and just take one step at a time. Remember, you've got to crawl before you walk, you've got to walk before you run. Good luck.